Hello and welcome. Pregnancy is, without a doubt, one of life's most exciting adventures. It's a time of huge transformation and so much anticipation. Today, we're going to walk through some of the key things your healthcare team keeps a close eye on to make sure you and your baby have the healthiest journey possible.
As your body is doing all this incredible work, it's going through some pretty gigantic changes. So all that monitoring, it's not something to be anxious about. Actually, it's a really positive and necessary part of the whole process, just making sure everything's on the right track.
So let's get right into it. We're going to focus on three major areas that your doctors and midwives are tracking. First, we'll talk about blood sugar. Then we'll look at blood pressure. And finally, we'll cover how to guard against some common infections.
Okay, first up, let's tackle blood sugar. You've probably heard the term gestational diabetes before, and we're about to clear up exactly what that means and why it's even on your doctor's radar in the first place.
So what is it really? Well, in the simplest terms, gestational diabetes is a kind of diabetes that only shows up during pregnancy. It happens in about 2 to 6% of pregnancies, and it's basically when the body struggles to make enough insulin to keep up with the extra demands of growing a baby. But here's the most important part. It's temporary. It usually goes away right after you deliver.
That brings up a really good question, right? Why does being pregnant sometimes throw your whole sugar balancing system out of whack?
It's actually pretty fascinating. It all comes down to two different metabolic phases. For the first half of your pregnancy, your body is basically in storage mode. It's building up fat and energy reserves. But then, right around 24 weeks, it flips a switch. It goes into release mode to make sure there's a constant supply of energy going to your baby. It's during this second phase that pregnancy hormones can make your body a little less sensitive to its own insulin. We call that insulin resistance.
So because of that big metabolic shift, screening is just a routine part of prenatal care for everyone. But your team will be paying extra close attention if you have certain risk factors. Things like being over 35, having a BMI over 25, a family history of diabetes, or if you've had gestational diabetes or a larger baby before.
And don't worry, the screening itself is really straightforward. If you have risk factors, you might get a simple fasting blood sugar test early on. But for everybody, there's another test between 24 and 28 weeks, right when that metabolic shift is happening. You'll drink a sweet liquid, and then they'll take a blood sample to see how well your body processed all that sugar.
Now, if you do get a diagnosis, the management plan is super effective. For most people, it starts with pretty simple lifestyle changes. We're talking about making some tweaks to your diet, getting in some moderate exercise, like a 30-minute walk a few times a week, and checking your own blood sugar at home. And if those changes aren't quite enough, insulin therapy might be used to help keep those levels right where they need to be.
All right, let's shift gears to our second topic, blood pressure. You know how at every single prenatal visit, someone wraps that cuff around your arm and gives it a squeeze? Well, let's talk about why that simple little check is so incredibly important.
And here's why it matters so much. High blood pressure conditions, or hypertensive disorders, actually complicate about 10% of all pregnancies. That makes it one of the more common challenges that your healthcare team is on the lookout for.
Now, it's super important to know that not all high blood pressure in pregnancy is the same thing. You'll probably hear two different terms. First, there's gestational hypertension. That's just high blood pressure that shows up after 20 weeks with no other red flags. Then there's preeclampsia. This one's a bit more complex. It's also high blood pressure after 20 weeks, but it comes with other signs that the body is under stress, like having protein in your urine, which can be a sign it's affecting your kidneys.
And with severe preeclampsia, there's some really important warning signs to be aware of. We're talking about very high blood pressure readings, a severe headache that just won't quit, changes in your vision like seeing spots, pain in the upper right side of your belly, or feeling short of breath. If you experience any of these, it is absolutely crucial that you contact your doctor or midwife right away.
This quote really cuts to the chase. When it comes to serious conditions like preeclampsia, the only real cure is delivering the baby and the placenta. Why? Because the problem actually originates from the placenta itself. So the whole goal of managing it is this careful balancing act, keeping you safe while giving your baby as much time as possible to develop before planning for the best time for delivery.
Okay, on to our third and final section. Let's talk about infections. During pregnancy, your immune system does this really cool thing. It naturally dials itself down a bit to help protect the baby. And while that's happening, there are a few simple things you can do to keep both of you safe from common bugs.
This is a fantastic, practical little guide. The main thing to see here is that for most of these common concerns, there are really simple ways to stay safe. For something like Group E strep, you'll get a routine swab near the end of your pregnancy to see if you'll need antibiotics during labor. For food safety, it's really just about cooking meat all the way through and skipping a few things like unpasteurized cheeses or deli meats. And those routine urine tests you do, they're great for catching UTIs early. See? All totally manageable stuff.
So, we've covered blood sugar, blood pressure, and infections. And I know, it might feel like a lot to think about. But the most important message that ties all of this together is actually very simple. You are not doing any of this by yourself.
You have an entire team backing you up. That includes your main provider, whether it's an obstetrician or a midwife. But it can also include specialists, nurses, support staff, and even your baby's pediatrician down the line. And you know who the most valuable player on that team is? It's you. Your feelings, your questions, your instincts, they're the most important part of the whole thing.
So after going through all this, what's the one thing that really holds it all together? What is the single most important key to navigating any little bump in the road that might come up during these 9 months?
It's this: consistent prenatal care. Simply showing up for your appointments is the absolute foundation of a healthy pregnancy. That's where things get spotted early, it's where your questions get answered, and it's where you and your team work together to give your baby the very best start in life.